Okay, guys, I have a discussion E for you. Tonight we're discussing a Framingham heart study. Data found that women with longer lifetime estrogen exposure measured by later menopause were uh, more live births and use of hormone replacement therapy tended to perform better on cognitive tests and have longer brain volumes, uh, though the results are observational and do not prove causation. What the page reports, the study source and sample. The write-up summarizes research using the Framingham heart study offspring cohort focusing on women who attended the 7th exam cycle from 1998 to 2001. The main analysis included about 1,329 women with cognitive testing and 1,165 women with brain MRI. Average age was roughly 60 years, and participants were free of dementia and stroke at assessment points. Why it matters. Framingham is a long-running community-based cohort, so findings reflect real-world variation in reproductive history and later life brain measures. Longer estrogen exposure linked to better cognition and longer brain longer brain volume. The page highlights three reproductive hormonal markers associated with more favorable brain outcomes: later age menopause, higher number of live births, and use of hormone replacement therapy, HRT, interpretation. These markers are proxies of cumulative estrogen exposure across women's life. The authors interpret the associations as consistent with a possible protective role of estrogen on brain structure and function. How research approached it. Observational associations, not experiments. The study examined uh, correlations between reproductive history and brain cognitive measurements in a cross-sectional slice of the cohort, and did not randomly assign HRT or manipulate hormone levels. Implication: associations can suggest hypotheses about mechanisms, e.g., estrogen effects on neurons, blood flow, or inflammation, but did not establish that estrogen causes better cognition. Context and consistency with other work. Mixed prior evidence. The page places this study within a broader, sometimes conflicting lecture. Some prior studies found protective effects of longer estrogen exposure. Others found no effect, or no potential harms. And timing dose of HRT appears important in other research summaries. University of Galway led work and related press releases also reports links between earlier menopause and higher dementia risks, and suggests HRT after menopause may reduce risk. Findings that align with the interpretation on the page. University of Galway. Limitations and practical takeaways. Limitations: observational design, potential confounding, e.g., socioeconomic health behaviors, genetics, and cohort specific demographics limit how broadly the result can be applied. Practical note: the page does not recommend clinical action. Decisions about HRT or reproductive health should follow individualized medical advice and consider risks and benefits beyond cognition. Bottom line: the page summarizes evidence that greater lifetime estrogen exposure correlates with better cognitive tests scores and longer brain volumes in this cohort, but emphasizes that these are associations requiring cautious interpretation, and further research. Okay, guys, that's it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks. See everybody tomorrow for shows.